Hi everyone, welcome to researchmd.com. My name is Pramil. We've got a great presentation today. We're going to talk about Rivaroxaban drug today, okay? And my name is Pramil Cheriyath, Program Director, Internal Medicine Residency Program, Transitional Residency Program. I teach medical students and residents. I'm also Director of Research and Assistant Professor of Medicine. So let's get into our subject. So description, Rivaroxaban, you have the chemical name and the molecular formula, Rivaroxaban, C19H18CIN3. Okay, that is the description. What does it contain? The tablet in the Xarelto, 2.5 milligram combination, or it could be 10 milligram, it could be 15 milligram of the actual Rivaroxaban. And then you got cross-caramelose sodium, you got hypromellose, lactose monohydrate in there, magnesium stearatase there, microcrystalline cellulose, and sodium lauryl sulfate. If you look at, they got a picture of Rivaroxaban. It's a factor Xa inhibitor, and the list price is like $492 per month. And if you look at the coagulation cascade and see like where does it work, its mechanism of action is selectively inhibit factor Xa without the need for a cofactor. Okay, so only thing you need to know mainly is selective inhibit factor Xa. It inhibits platelet activation and fibrin clot formation by direct selective reversible inhibition of factor Xa in both the intrinsic and extrinsic pathway. We got a nice picture. You got the intrinsic pathway 12 to 12A, 11 to 11A, 9 to 9A, and then you have 10 to 10A. And then you can see the extrinsic pathway is 7 coming and helping the 10 to 10A formation, and that's where Rivaroxaban work. Okay, so there is involvement both intrinsic and extrinsic pathway. So what are the indications of Rivaroxaban? Atrial fibrillation, cerebrovascular accident, systemic embolism, coronary artery disease, peripheral artery disease, and venous thromboembolism, including DVT and pulmonary embolism. So what are the doses? Like, acute coronary syndrome is a recent coronary artery syndrome, cardiovascular event risk prophylaxis. You can do like 2.5 to 5 milligram orally twice daily. And then atrial fibrillation, you have to look at the creatinine clearance always because it's renally excreted. If it is creatinine clearance is less than 50 ml, then you have to do 50 milligram, otherwise you can do 20 milligram. Cancer and venous thromboembolism, 15 milligram orally every 12 hours, and cancer venous thromboembolism in high risk outpatient prophylaxis can be 10 milligram orally once daily up to like 6 months. DVT, again, make sure you calculate the creatinine clearance if it is greater than 15 ml per minute, 15 milligram twice daily. DVT, again, 10 milligram orally twice daily. Cardiovascular event risk, cardiovascular death, myocardial infarction, stroke prophylaxis, coronary artery sclerosis in combination with aspirin, 2.5 milligram twice orally daily. And cardiovascular event, major thrombotic vascular events including MI, ischemic stroke, acute limb ischemia, and major amputation of vascular etiology, you can do prophylaxis 2.5 milligram orally twice daily. Given the pediatric dose also for venous thromboembolism, we start from it's an oral substitution based on the weight. Anywhere from 2.6 to 2. We have this nice table up to 50 kg, can go up to 20 milligram per daily, but start in 2.6 milligram. If the weight is 2.6 to 2.9, then you have to give like 0.8 milligram. Okay, transitioning. When do you switch when the patient is on Coumadin, right? Like switching from warfarin to Rivaroxaban, discontinue warfarin and start Rivaroxaban as soon as the INR is below 2.5. Remember that. When the INR becomes less than 2.5, you can switch. And then switch from Rivaroxaban to warfarin, continue Rivaroxaban for at least 2 days after the first dose of Coumadin. Okay? After 2 days of co-administration, obtain an INR before the next scheduled Rivaroxaban dose. And continue co-administration of Rivaroxaban and warfarin until the INR is at least 2. INR testing could be done reliably 24 hours after the last Rivaroxaban dose, and switching from Rivaroxaban to anticoagulant with a rapid onset, discontinue Rivaroxaban and give first dose either oral or parenteral anticoagulant at the time of the next Rivaroxaban dose would have been taken. Okay, Now, adverse event, what are the adverse events you can expect? Of course, it can cause bleeding, cardiovascular, it can cause syncope, rheumatology can cause pruritus, and very low incidence. Gastrointestinal can cause abdominal pain, GI hemorrhage, hepatic can cause LFTs could be elevated, nervous system, there's going to be anxiety, depression, dizziness, neuromuscular, like back pain, 3%, limb pain in 2%, and hematological and oncologic or hemothalamo, surgical bleeding, and nervous system intracranial hemorrhage. Again, every drug has some complications, and it also, Rivaroxaban also have some adverse effect. Use in renal impairment is also very important to know. Okay, renal impairment in adults with the coronary peripheral artery disease, you don't need to do any renal adjustment necessary in with the coronary artery and peripheral artery disease. In renal impairment, if the creatinine clearance is like less than 50 ml per minute, 15 milligram orally twice daily, and each one we have given the dose right there. And then use in hepatic impairment, any say like moderate or severe, you can do the child B or child C classification. Don't use. No clinical data available in the pediatric patient with hepatic impairment. In the pregnant women, Rivaroxaban crosses placenta. Okay, so use direct acting oral anticoagulant, increase the risk of bleeding in all patients. So when used in pregnancy, there is also potential for fatal bleeding, subclinical placental bleeding, which may increase the risk of miscarriage, preterm delivery, fatal compromise, and stillbirth. So don't use in pregnant women. Okay, use in lactating women until safety data available. Direct acting oral anticoagulant not recommended. Okay. So monitoring, you can do PT, PTT, bleeding risk, Aspler score, signs and symptoms of bleeding, CBC early, liver function test, renal function test, plasma concentration of Rivaroxaban. Thank you so much for watching. We'll be back with another presentation. Thank you.